Horizontal strabismus, an isotropia or an exotropia, whose the angle of deviation is greater down than upwards by about 10 diopters. This is called a pattern strabismus. This may not be functionally significant and not require treatment in all cases. A pattern strabismus may be isotropia up and orthotropia down, and isotropia up and less isotropia down, and orthotropia up and exotropia down. Lastly, exotropia up and greater exotropia down. In cases of isotropia up and orthotropia down, the surgical procedure is recession of both media recti with upward transposition or temporal transposition of the superior rectus of both eyes. In the case of isotropia up but less isotropia down, we determine if there is overaction of the superior oblique of both eyes, of normal action of the superior oblique of both eyes. If the superior obliques are overacting, the treatment is bilateral superior oblique tenectomy plus bilateral media rectus recession, or bilateral superior oblique tenectomy plus resection of a lateral rectus and recession of a media rectus. If the superior obliques are normally acting, the treatment is bilateral media rectus recession with upward transposition, or resection of the lateral rectus with downward shift and recession of the media rectus with upward shift of the insertion. In the case of orthotropia up and exotropia down, if the superior obliques are overacting, the treatment is bilateral superior oblique tenectomy. But if the superior obliques are normally acting, the treatment is bilateral lateral rectus recession with downward transposition, or recession of the lateral rectus with downward shift of the insertion and resection of the media rectus with upward shift of the insertion. In the case of exotropia up but greater exotropia down, if the superior obliques are overacting, the treatment is bilateral superior oblique tonectomy plus bilateral lateral rectus recession, or bilateral superior oblique tenectomy plus recession of a lateral rectus and resection of a media rectus. If the superior oblique are normally acting, the treatment is bilateral lateral rectus recession with downward shift of the insertion, or recession of a lateral rectus with downward shift and resection of a media rectus with upward shift.